the whole world right now still has that belief and a picture of what a pharmacist should look like. And that's in the box of a retail, pharmacy. But over 2 decades ago, the image should have evolved to match that as a clinician, when over 70% of primary care, those visits are actually talking about managing medications, and yet we've got the lack thereof of one of the experts in how to use that. And we're not here to take away your work, take away overall that you're leading the care overall with the physician, but that we want to be the partner in helping relieve the burden and improve patient care.
Hello and welcome to the Uprising Show. And today I have a very special guest, Dr. Ashley Pendrick. Hi, how are you?
I'm doing amazing. It's Friday, so it's one of the best days of the week. How are you?
I'm doing great too. Same feelings. So let's start for our listeners. A very brief introduction of yourself in your own words, please.
Yeah, so I'm Dr. Ashley Pendrick, and I'm a clinical pharmacist, board certified in geriatric care, and I've been a pharmacist for now 7 years. Really crazy to think, but I'm really passionate about advancing the clinical integration of pharmacists and speaking out on the value of how to utilize these experts in patient care.
This is really, I want to just double click what she said on, because I found her, or I and my wife actually, we both found or discovered you on LinkedIn. And one of the reasons what really stood out was the kind of stand you're taking in your messaging that attracted us. Like, wow, okay, clinical integration of pharmacists into medical practices. And what is that? And that was kind of the starting point of all this. So we'll go into that. But before that, let's just rewind. Before Prosper RX, which is your company, before PharmD, where were you born and raised, and were either of your parents a pharmacist?
So I actually was born and raised in Fayetteville, North Carolina, and around 6th grade, I actually moved to Arizona. And now I'm back in North Carolina. Really excited to be there on the beautiful Crystal Coast here. And neither of my parents were actually a pharmacist. My dad was a mechanic for airplanes, and my mom, for all of my childhood years, was actually a cosmetologist, but she always wanted to be in healthcare. And so she really educated me as I was a child, and my brothers as well, as to, what the healthcare industry was. And she did end up going back to school, and she got education to become a respiratory therapist and actually a sleep sonographer as well. So she ended up joining the healthcare industry. And I think that's where really I started my passion and trying to help people, really, and trying to determine where I belonged in the healthcare field. I think ultimately took quite a while, but I landed on becoming a pharmacist, and here I am.
And was the inclination towards pharmacy just came naturally, or was it something that led to, let me do, go into pharmacy world versus other things in healthcare? What was that moment, and what led to you there?
Great question. So actually, I had everything ready to go to finish the dental hygienist program, and I was about to, put my money where my mouth was, and put myself into the program. And I decided, after speaking to several of them, I don't know that I want to be in somebody's mouth for the rest of my life. A lot of them weren't happy. And so in my past roles, I was a financial institute banker, and I provided a lot of services for several pharmacists in the area in Arizona. And I got to talking to them, and a lot of them had the discussions as to the different areas that pharmacists can be utilized. And one of the pharmacists was actually in the ICU. And so that opened my eyes to the opportunity of pharmacists are not just in a, CVS or the big name retail industry, but they are in almost every aspect of patient care, and that's where they belong. And I found a program right down the road. So I re-switched my gears and went towards that track. And I fell in love with the program, but really how to utilize us is really the clinical role. We delivered patient care throughout the entire program. I just didn't have to do procedures, and I didn't have to, cut or do diagnosis or anything like that. It was just the actual management, education, and sharing, all sorts of different options for the patient.
This is great. And so kind of like dentistry's lost, pharmacy's gain. That's where you're headed out.
Yeah.
Okay, it's cool. Nothing against the dentistry though.
Not at all. And to be honest, I mean, everybody's got their passion and need. We need them. And I'm like, I've got my dentist appointment already scheduled regularly.
Yeah, cool. And so obviously, like I said, something that I read on your LinkedIn, and you call yourself as a rebel pharmacist. So what does that label mean to you? And what shaped your belief that pharmacists can and should play a far bigger role in clinical care? Let's talk about that.
So one of my mentors, she actually called herself the rebel pharmacist. And with that, I took that mainly because, one, I have a holistic wellness practice. It does start with lifestyle. Everything really should. And two, I've never once actually worked as a pharmacist in the retail or even the hospital setting as a pharmacist. I have gone the non-traditional route my entire 7 years now as a pharmacist. And so not only that, I've become, obviously, as you know, a little outspoken as to how we can be utilized. And so the profession itself and pharmacists, I think, naturally may be more of the people pleasing and not necessarily able to, stand up and highlight and share how we can be utilized. So being a rebel is more of, I've got a voice, I'm able to use it, and I definitely don't fit the traditional mold. And I don't know that any of us really should, but some of us are forced to do that. And I think the whole aspect of playing a bigger role in the clinical care is, if you break it down and take several steps back, that's the PharmD training. The training was not meant to, here, check some drug interactions and make sure they're good. That's not the training. It is direct patient care, education, utilization, and safe use of these medications, and monitoring them and adjusting and titrating and starting therapy, and really overall trying to problem solve. And so it wasn't necessarily, the shape, the belief, but it's just the training. It's just our overall, the whole world right now still has that belief and the picture of what a pharmacist should look like. And that's in that, the box of a retail, pharmacy. But over 2 decades ago, the role should have evolved, and the image should have evolved to match that as a clinician.
I love this a lot because we don't hear this a lot, especially when we think of pharmacists. It's really just, we think of mostly retail part of it. And I guess just a follow-up question to this, how do you, like, people, the pharmacists who don't go on the retail side, what other options do they have outside of retail? Is this the route, the one that you're pursuing, that's the only other option, or are there any other options as well? Could you?
Oh, I think you are opening a can of worms. So I call pharmacists a multi-tool. Reality is, and I actually, another one of our mentors in the industry calls the PharmD a STEM degree. Because realistically, you think about healthcare tech, you think about any kind of operational when it comes to clinical decisions. We know pharmaceutical, right? Pharmacists are experts in that. Clinical drug trials, veterinary medicine, nuclear medicine, emergency medicine, intensive care. I mean, anywhere that there is medications and care being delivered, or a lot of complex medical terminology to then take down and put into patient education. There are so many different avenues for pharmacists. And I will say right now, pharmacists do feel like they're trapped in a way that there aren't very many options. It's just we have to broaden our horizon and start applying for areas that don't say pharmacist as a requirement, but be able to speak to, again, how can you utilize that PharmD, that skill and the education and the knowledge, and apply that into these different various fields.
I don't know if this is just, coincidentally it happened for me. When I started this podcast, I actually had in the first few episodes, Dr. Joby Jones, who is actually a pharmacist from background. And then he ended up starting a company which is personalized medicine. So they really came up with a telemed platform. Shout out to him if when he listens this and then his thing was make it more personalized. So he came from the personalized angle. Let's make sure before we even start prescribing, let's create those profiles and use this biomarkers already present with the physicians. So even before the order is placed, that's right and taken care, right? And that was his whole thesis. And he's now actually currently, I think, the president for the Texas Pharmacy Association right now. He's a current president. He just got elected in the most recent term. But I have been kind of like, that was the part when I started to explore, oh, you know what? It is so much more that goes into pharmacy. It is so much involved and there is so many pathways. But it's just like I feel like the awareness is not there. Why do you think that's the awareness is missing? Who's missing the ball here? Is it like the association itself? Not to point the fingers, but more like, what is
And it's multifactorial. If you think about, I hesitate to say this, but the industry and its image of a pharmacist was really tarnished when we've got the big box coming in. And I'll be honest, the drive-through, they fast food, that whole model, like that's not the whole point. And so the whole image of a pharmacist still is revolving around that and speed versus that engagement and interaction, to where, of course, nobody's going to understand what value we have when they're not really receiving it, versus here's, a product driven model. Here, have a great day, right? They're not going to feel that. And I've said this for now a few years. We do really need a whole PR move, a rebrand as to what a pharmacist is and how they can be used. And I mean, who's to own an entire profession and rebranding them?
Yeah, look, somebody has to start.
I know. Well, I mean, here we are again. Like I said, a little outspoken, and I've got plenty of things to say.
Yeah. So let's talk about Prosper RX. And you started the company not too long ago, right? 2019 is when you started.
Yeah, it sounds about right.
Okay. So what was the thing that pushed you into like, okay, you know what? Let me create this consultancy for embedding pharmacists into clinical workflows. What was like the pain point or the trigger point for you?
I went through a program and I actually learned a good amount of some of the billing capabilities and how to utilize a pharmacist through collaborative practice agreements. And when I was going through this, it was also at a time where I personally was burnt out, and I was in a managerial role and providing a lot of education, training, and overall leadership development. And I was looking for a way, an outlet and creative outlet. So I, built Prosper thinking maybe I could help and get into a practice myself, but realized that it was a lot bigger than me. And I felt more of the calling to utilize this knowledge and passion to bring it for more pharmacists and more practices and more clinicians and more patients, ultimately, which is what everybody gets into this for. And we're seeing the amount of harm, right? And education and lack thereof, and several areas where things fall apart. And we've got medications and errors. And overall, that's one of the top 5 causes of death right now is, unfortunately, medical errors, and a lot to do with medications. And so when we utilize pharmacists, when over 70% of primary care, those visits are actually talking about managing medications, and yet we've got the lack thereof of one of the experts in how to use them, how to properly educate and manage and titrate and follow and monitor these medications. It's no wonder that we have things kind of falling apart, and patient care is unfortunately still, it's being harmed with these medications and things that we all want to help with, right?
I also feel like there is this wave that's happening right now, right? Like we are, especially in this country, like we're seeing this, like people want to have preventative care, right? Like they want to treat almost like, not to say it's like a sorry state of our healthcare system that we want to think this way, but it is a two-tier system. We want to think like there is a sick care model, which is okay, if I get sick, then I go through this traditional health system, which is, I hope it's only when it's extreme, more like car insurance. I don't have to use it, great. If not, but before that, I really want to have preventative care, and for that, it needs to happen is the primary care needs to be better. I need to get more time with my, physicians or clinicians, or I need to have better biomarkers. I need to know what works for me and my body. And that awareness needs to be there. So there's this thing happening. There's this building awareness, which makes me also think that the consumption of supplements, medicines, everything is going to go up. Right. And this is like, and then we will, and I almost feel like doctors, of course, they have a role to play, but it's like almost like they're already burdened by so much of everything else. Now you have this wave of going up of supplements and medicines, and it will become more of lifestyle, if not lifestyle, at least become part of the life. Let's say that for now, to even with GLPs and everything coming in, right? So all that stuff is going to happen sometime sooner, maybe even in the next 3 to 5 years. So I feel like this is the perfect storm for pharmacists to just say, like, you know what, we're going to stand up and take this opportunity and make sure we either integrate well into practices or independently create avenues for people to support people in this journey. So what's your take on that? Do you agree or do you see something different?
There are actually a whole realm of pharmacists as well as other clinicians and practitioners, and even some that aren't medically trained, stepping into these lifestyle education, wellness education, and interprofessional integration with holistic and functional medicine and helping with that preventive route. And I know the whole point of even me starting at my holistic practice originally was my husband was pre-diabetic, and the traditional model was not helping him. I asked for help. I reached out, and I got nowhere with our current providers. And it was like, okay, I'll take things into my own hands. I've got the education, the knowledge, and how to educate and, take things and improve his lifestyle and get him off that track. And so, like you mentioned, really, the fact is we've got to help in reducing physicians' burden and allowing them the time, but also other options, for physicians, pharmacists, and whatnot to create some of those models. I actually talked to a physician recently, and we're looking at the preventative codes and utilizing pharmacists in their education avenue as well to help. Because if you think about how the pharmacist education compares to some of the medical education, pharmacists are trained in communication. We have to be able to educate, counsel, and share in motivational interviewing techniques to allow the patients the option and the time to understand their care plan, to understand their treatment, and to understand the medications and the risks, that are involved and the benefits, and trying to get them to, remain in adherence to the overall care plan. And so you take that a step back. They're absolutely qualified to help in some of this preventive care with smoking cessation, weight loss. You think about just nutrition and how to utilize, like you mentioned, the supplements, and how to read some of these tests and not just throw the, one supplement at it. We've got to talk about some of these other minerals and how they play a role before you just throw some more medicines and supplements at it. So they're absolutely a great, I think, again, tool to utilize in something like that as well.
Yeah. And also to the point, like, believe it or not, our environments are not good. We are consuming whatnot. So there are times when you run those labs, you discover you are on different levels and thresholds on certain elements. And that happens, then you almost need not just from outside view to like, oh, this works there, whatever. You need to look other stuff too, right? And it becomes more comprehensive. And it's a good direction overall, but kind of how we got there is a bad thing, but it is what it is, right? So it's like we have these tools in hands now, and we should use it for sure to make it better. And it's giving us more transparency just to understand everything, right? That's why we're even talking about it. Otherwise, who knows what we will talk about about this now? There is no way of knowing what we are eating, what's in our biomarkers, or how things look, right?
Exactly.
You are definitely like to say like redefining primary care teams dynamics, right? Like you're kind of like going into part of becoming that team. So in your experience, what happens when a clinic finally brings a person like you in, and what changes most visibly from both providers and patient side happens? Can you talk about that a little bit?
Yeah. So when clinics bring in a pharmacist with a really clear cut strategy and not just throw them into the team, we can really see the physicians start to, I would say, thrive and reduce some of that burden that they've got. Because again, almost 70% of their visits are going to possibly entail managing, talking about medications and adjusting and starting them. And when you relieve some of that, overall, that's a lot of friction that they're having to deal with on a daily basis, anywhere from 15 to 30 patients in a day. And so that gives them some more mental energy to be able to tend to some more patients or be able to provide some of the education that the patients are thriving and really wanting to hear, and creating real relationships with their patients and bonds instead of just staring at their computer, which unfortunately sometimes happens. And so for the patients, they're going to create and have a lot more trust in their care team because they're being given the time, the knowledge, the education, and a lot more hand holding in that, and making sure that some of these barriers are cared for. And we talked about medications, but like we all know the costs are high rising, right? They're skyrocketing. And so getting through and navigating some of the complexities, prior authorizations and refills and questions when some sort of potential side effect comes up, a pharmacist is an absolute critical team member to be able to take that burden off of the physician and allow them to, mitigate it and reduce the hospitalizations for patients, and causing some of these, after hour calls and messages that we've talked about. A lot of them are medication related, or just really possibly even simple questions on their disease state and understanding or interactions. And the way the care team's set up right now, pharmacies aren't reimbursed for a lot of that, the education aspect. And then the physicians, again, they've got that burden of the time. And so we're bridging that and allowing them to get more time with their team and get the education and understanding overall. And so the providers are a lot more satisfied, patients are a lot more satisfied, hospitalizations are being reduced. And ultimately, when we improve all of this, we've got the improved adherence, improved understanding of the disease, and improved patient outcomes, right? And that's, again, what we're all here for, is to help with reducing the cost of their care and improving how they're being cared for.
I have no doubt, because I was telling you before we were chatting that we kind of did that unintentionally when we were building that software company for patient communication. We had pharmacists join the chat with the practice, with the patient, just with the thinking that this will improve care coordination, this will improve everything else, medication adherence. And but I never thought it from this lens as like how important it is, but I thought from a communication point of view, it was great, right? So that was the biggest thing. But the more I think back now, as we are having these conversations, the more I am thinking, wow, there was like so much parts were like the clinical parts to that, right? In the care coordination part to that, the medication adherence part to that. And these are all things that is like so important in just making the whole care better, just for better outcomes, right? So now I'm like This is so obvious. Why I didn't like think in, obviously, yeah, yeah, exactly. Not like, you live in your own bubble, right? So I was like, oh, it's really solving the communication problem, but actually it's far, far bigger, right? So that's kind of the moment I had just now listening to you. So, of course, we talked about the ROI too, right? So there is pharmacist-led interventions have, as you said, that it's like 12 is to 1 ROI versus 2 is to 1 in the other case. So now my question is like, if the ROI is so clear, right? Like, so what is or why are so many clinics still not embracing it? Like, what's the hiccup there? Fear there, or just ignorance, So what is that? Please talk to us about that.
Different points. Again, we talked about the need really for the understanding. I think the PR move as far as like what the training a pharmacist receives is and how that's not just for the, drug interactions, but direct patient care education. And I think overall the system itself, I think, and the practitioners out there, if they've been in practice anywhere from maybe 10, 15 years, the interprofessional roles of all of the care team members, including pharmacists, social workers, physical therapists, all the different avenues, that wasn't likely, integrated in their education. And one of the physicians I spoke with recently was even like, how do I do this? And I've never heard of this. How does this work? And it's not an easy process overall. And so I think that nobody in this realm, in the healthcare setting, in the clinics, have familiarity with how do you hire a pharmacist and what are some of the protocols that we would like to follow. How do we make sure to make the most of them and have that ROI that we talked about from anywhere from 2 to 1, 12 to 1. And in order to do that, you really have to take several steps back and identify where is the practice struggling and use them as an ammunition to help improve that. And I think that there's really been some misunderstanding, and some, I wouldn't call it ignorance, just a misalignment really on how we're defining a pharmacist and who's owning patient care. I know even patients get frustrated when a pharmacist questions the doctor on a medication, but the whole role, unfortunately, is kind of what we would say a gatekeeper to make sure everything's safe. And since there is no collaboration, at least on a grand scale, between the physicians and the advanced practitioners and the pharmacists, there's that breakdown as well as to what is the role of a pharmacist and why are they even questioning me for the practitioner or my care, right? It's that whole misunderstanding and misalignment on what is the role of a pharmacist, how can we use them, and how do we integrate them and making them easy. And I know that's where we try to come in, and every state is different too. So we've got legislation in the way, and CMS is a whole nother story. I mean, not to say they're dinosaur age right now and not recognizing pharmacists as a provider, yet we've recognized so many other in the clinical realm as a provider to be able to provide billable services, and yet pharmacist isn't on their list. State by state, that's being corrected by the actual state, the plans, Medicaid. So we're on the right trajectory. It's just getting the word out on how to use a pharmacist and how to really have them mesh with the team and become part of that to reduce the burden and create efficiencies for the entire team.
I have obviously, I grew up in India, so there to this date, people just directly go to the pharmacies and they make the call of what medicine they can get. So people can literally just go in without prescriptions and they ask the pharmacist like, hey, I'm not feeling well or I'm feeling like this, what should I take? And they prescribe the medicine. So, and this is all without prescription, right? So of course, the stuff also happens through doctors when they prescribe as if you are in treatment, but it's kind of when I travel there, it's just different. Like how it works makes me always question certain things on both sides. One, I always think like, oh, I don't know if this is good, because if it's not, I don't know if it's regulated or not. I don't know what if, like, who's liable in that case, right? That's the fear I have on that side. But then I also a lot of times like, oh my god, it's so easy. I had less friction. I just got what I needed quickly, and the right guy, this guy just, you know, he's running this pharmacy for 30 years, and he just like with his experience and education was just able to like, I saved all the time that and costs of that system. So what's your take on that? Do we need to like kind of rethink that a little bit more, like how it's done?
Yes, you bring up a really great point because, like I was saying about how state by state there is increasing in advancement and the ability to practice independently and really get the reimbursement for some of those clinical consultations that you speak of. I know even in, we've got several countries, Canada, I've spoke to several pharmacists as well, and several other countries where you just walk into the pharmacy and if there is a problem, they do have certain prescriptive authority. And in our country here, several different states are and have utilized some of the legislation to advance for minor ailments. We think of UTI. I know there's some changes, for ear infections and strep throat, things that are testable, right? I know there was a huge amount of uproar with pharmacists and COVID testing and treatment, and there was a lot of friction on that. But again, the pharmacists are clinically trained to be able to deliver exceptional patient care and make sure it's the right medication, right dose, and overall taking that patient specific factors, everything the patient provides. If we have more access to their records as well, that's another barrier. But we have the capability to triage patients and be able to provide some of these care. And actually, one of the physicians that I know working collaboratively, specifically with a pharmacist, is developing, I'm sure you know about Ovariate and helping to prescribe birth control contraceptives and options at the pharmacy. And realistically, how we can, do that for several different potential complications. And I feel like the pharmacy and the pharmacist are and can be a hub of health. And I think that, again, relieves a lot of burden off of not just the primary care. We think about emergency care and emergency facilities, the urgent cares. A lot of them, they become at capacity. And pharmacies are accessible, but we're also seeing them close down because we're not getting reimbursed for the clinical aspect and just the product. So there's so much to unpack in that one question, but I feel like we scraped the surface of it.
Yeah. And by the way, something similar already happened for physical therapy, right? It used to be that business where you cannot get without referral to the PT doctors. And I at least know in the state of Pennsylvania, it's just now it's direct access physical therapy. So you go directly to them for the care, right? And it's also becoming commodity because a lot of the population now have more chronic conditions. There is bigger need for, there's more older population. So you have to find ways to remove the friction so the care can happen directly, right? And that has helped a lot tremendously. Like that's why I almost feel like we also physical therapy as a profession is now turned into more like, well, this is part of the lifestyle. It's not like just when you get sick, but it's also like to like you don't get sick. That's important too, right? So this is nobody has to live with pain, hopefully, right? So that's where it's going to, right? So I feel like it has happened. We have models of what has changed in different specialties. So I almost feel like we need to cite that, like, hey, look, this works. So let's do it here as well. Why not? Right. And that's kind of how we'll have to do that. But hopefully we are moving in positive direction. That's the most important thing. Now, obviously you speak often about services like chronic care management, RPM, BHI, but which of these have the biggest quick win for practices? Let's say for medical practices listening to this pod right now, what would you recommend for them?
That is a great question. And I know there's so many different avenues, but the quickest bang for your buck is going to be the chronic care management. If you wanted to leverage them in that aspect, utilizing a pharmacist run program, then you're going to get a lot more education, motivational interviewing, and really overall clinical monitoring that you're not going to get from another clinician or role that's often running chronic care management. And whether you start your own program, a pharmacist can and are doing those chronic care management directly with the practices as either a contractor or an employee. And of course, when you do it that way, you're going to have, you've got your overhead, but at the same time, in the big picture grand scheme, that model will bring you in more revenue directly, or you utilize the company that we work with as well that has a, very streamlined process. There's no upfront cost, and you tap into a pharmacist and their knowledge and their education for your patient population. And overall, it's just that flat fee per patient. And so that's an easy, really quick win to be able to have that pharmacist integration. And it's just, which route do you want to go? Do you want to build an entire program and the pharmacist can help with that? And again, you've got either a contractor or an employee doing it. But at the end of the day, you get more revenue. Really, you get to keep more, or you use a company as well. And it's easy. You don't have any employees or contractors. You've just got a company that's running and manning it. And some of the things that we're catching with these, I know nurses aren't going to catch some of the things that a pharmacist are going to see in these conversations with our patients.
Interesting. And of course, from, you've been into this world now on the other side of it. So what parts of healthcare do you believe are like almost like felt like deliberate to keep pharmacists in a smaller role than they should be? What do you think? What's your thought there?
So Vivek, I'm sure you may have seen the American Medical Association has spread misinformation on the role of a pharmacist and the education of a pharmacist. So I know specifically one of the areas that they continue to advocate for is scope creep. And that's people practicing out of their scope, practitioners out of their scope. And they actually shared with both the House and the Senate some misinformation on PharmD degree and how we're trained, and saying that we are not able to perform a physical examination, make diagnosis, triage severity, or prescribing. And I'm pretty sure they did not actually consult with a pharmacist that's gone through the PharmD program, because we were trained to prescribe and optimize prescriptions and overall monitoring and therapy. And actually, July 2025, the ACPE has now put in the actual overall requirements for the education program of the PharmD to include diagnosis, even though I know it was already required or at least covered. So diagnosis and how to, at least identify those that are struggling with disease and whatnot was covered in the PharmD program. And so there's some misinformation being shared. And on top of that, really the misunderstanding, that we've talked about. And I understand there's a lot of liability the physicians have to manage when it comes to patient care. And so I know they also, are under the impression and really concerned with a pharmacist and them stepping out of scope and possibly hindering care, right? But if you really look at any of the evidence, and I mean hundreds of trials, this isn't just one trial, not two, this is hundreds over the last 2 decades. Pharmacists superiorly manage diabetes, hypertension, heart failure, asthma, COPD. You ask a diagnosis, I'll share a trial with you. And so if we can all get on the same page and understanding that we're here to help and we're not here to take away your work or take away overall that you're, leading the care overall with the physician, but that we want to be the partner. Pharmacists want to be the partner in helping relieve the burden and improve patient care and outcome. And if we were doing a really well job right now, medical errors and medication problems wouldn't be one of the top 10 causes of death and causes of patient harm and causes of hospitalizations and ED visits. We need more pharmacists involved in care, managing, prescribing, monitoring, and education together, whether that's in the pharmacy, in the clinical practice, consulting, in preventative care, you name it.
So the people who are listening, it's not just RX, it's RX and DX. And that's what together it is. And that's what the direction it is. I'm surprised that almost everything that you describe is like literally the job for
Yeah.
pharmacists. The information wasn't syndicated in the right ways. A little mind boggling, but it's crazy. This is the world we're living in. What would you say to the physician who's on the fence, especially bringing a pharmacist into their clinic? What do you wish they understood better?
I would reflect, how often are you talking about medication? How often are you titrating them? How often are you starting them? How often are you getting some of these calls and questions? And how is your adherence? How's your hospitalizations rates? And if you're referring patients out for maybe asthma, COPD, diabetes to a specialist in a primary care and internal medicine or family medicine practice, keep those patients in-house and bring a pharmacist in to support managing these, because a lot of them, I understand their medication, their education, and his constant following, and that you may not want to complete that. You might not want to, do a lot of that hand-holding. And if you want to keep some more trust and also reduce some of the complexity in that patient's care, then having a pharmacist support in that and managing some of these patients versus referring out, I think would help everybody. And also the specialist, I know here where I'm at, it's up to a year. And that's on average to get into an endocrinology office. Primary care is not managing them. Who's going to manage these patients if they have to wait a year to see endocrine?
Yeah, it's the crazy part of everything. That's why we're also seeing a lot of people go towards, no, I'm just going to pay for this membership model because we have access. But the issue with that is then it's kind of eliminates the 50% plus population from that access situation. Yeah. Well, this has been great. I appreciate your time. Before we end this conversation, we have last quick fire personal round where I'll ask you a few questions. And are you ready?
Yes.
All right. So tell me one book, podcast, or anything else that had a big impact on your thinking in this last year.
I recently watched a presentation on burnout, and it was delivered for physicians and the healthcare team. And they actually brought up, it was a reverend, and he brought up moral distress and that particular conversation, and how if we're not getting serious on our finances and how we're being reimbursed, then it's almost near impossible. You will have moral distress. And so that's right there, the summary of where clinical pharmacists are with us not having the reimbursement on the grand scale to be reimbursed financially for the clinical aspect versus the product. That's where we stand. And that's where I'm here to try to at least highlight and educate that there are modalities to get pharmacists able to have billable events through physicians and other methods.
And what lights up more, training pharmacists or transforming clinics?
Oh, that's a really great question. I feel like the training pharmacist is probably going to be where it's at, because I have a real passion for education. And with that, I think I'm only one me. If I train more and more of our pharmacists to get out there and showcase exactly what I'm saying, then we will transform more clinics.
Yeah, that was a trick question. I like your answer. You basically said like, okay, let's get more pharmacists trained, transformation will happen. So that's a good answer. All right, cool. You're also a cafe owner, and what sparked the idea behind Kids at Play?
Yeah, my husband was in law enforcement, and we moved to a very small, I shared a rural area, and it's absolutely gorgeous, but there is also limited job opportunities. And so we decided, as we have two small little ones of our own, there's not enough to do in where we're at besides the aquarium. So we started an indoor playground to really give back to our community and create that village that's needed because there are a lot of transplants in our area from people moving into this region because of how gorgeous it is, that we don't have that village to bring, our family up and our children together. So creating a safe, inviting space for also families to take a minute to breathe, because we focused on the parents, Vivek. If you don't focus on them and having comfort for them to have a couple minutes, enjoy a coffee or some pizza, and allow your kids to play and know that they're not being harmed, they're in a safe padded area and enclosed and air conditioned. It's been a real journey and experience, and really rewarding. All of our community absolutely appreciates the cafe.
Love it. This is great because I feel like, it not only helps you bring other people together, especially other kids together, but also kind of like providing that space for, parents to take a break and also have that cup of coffee there while kids can be there too. So
Yeah,
that's a good avenue. Even I have to check it out. More details. I'll dig into this
it
afterward.
gets pretty rowdy.
Oh, that's good. Cool. Well, this has been great. I appreciate you. Thank you so much. But if our listeners want to get in touch with you, how can they find you? Where they can find you?
You can find me, of course, on LinkedIn, like where we met, and our website, prosperrxconsulting.com. And our email is info@prosperrxconsulting.com. But I'm absolutely open. Actually, Kay Pendrick on LinkedIn. You'll find me there, pretty active as well.
Fantastic. We'll put all these details in our show notes, wherever you get the show from. And thank you once again. It's been a great episode. This has been almost the area of healthcare that we haven't covered much. So this helps also to play our part in spreading awareness. And, like I said, one we did initially, and this is the second one we are doing it. So this is great. Thank you for sharing all the insights. Much appreciated.
Appreciate your time. Thank you.